Good afternoon, everyone, and welcome to today's webinar, Building a Culture of Donation Through Effective Hospital Association Partnerships. We're glad that all of you could join us, and we have a terrific presentation planned for you today. My name is Corey Bryant, and I'm the Communications Manager for the Alliance. We have just a few logistical items to go over before we begin today's program. For those of you who have never joined us on this webinar platform before, the chat feature is located in the bottom left-hand corner. If you have any questions that come up during the webinar, feel free to submit them at any time. And once the presentation is complete, we'll have some time for our presenters to address as many of your questions as time allows. Now, we are recording this webinar, so we will not be opening the phone lines. That means that all questions must be submitted electronically using the chat feature. Registration is currently open for our upcoming transplant webinar addressing the opioid epidemic, organ donation, and transplantation. Certainly a very timely and growing topic in our community, so be sure to join us for that on April 19th at 3 p.m. Eastern. Registration is also open for our next Get Connected webinar, utilizing elements of behavioral design and improving hospital OPO communication. That's coming your way on May 8th at 2 p.m. Eastern. You can register for all of these webinars and more on our website at organdonationalliance.org. Now, for today's webinar, we are offering 1 SEPC credit and 1 nursing contact hour, courtesy of Iowa Donor Network. Everyone listening to today's webinar is entitled to claim continuing education credits, and if you're listening in a group, we know that many of you often do, please make sure to get the evaluation email from your group lead. It's a very brief online evaluation which will allow you to receive your credit. As a reminder, for nursing, you have 14 days to claim your CEs, and for SEPCs, you will have 30 calendar days. At this point, I'd like to introduce today's moderator, Amanda Hadermel. Amanda is the Manager of Hospital Development for Units in Buffalo, New York, and a member of the 2018 Alliance webinar faculty. Amanda, we're glad to have you with us, and at this point, I will turn it over to you to introduce today's speakers.
Welcome, everyone. Our first speaker is Mary Marshall, the Director for Workforce and Professional Development at the Hospital and Healthsystem Association of Pennsylvania. She serves as the primary contact for professional practice and workforce development issues. In her role, Mary works closely with hospitals and health systems, human resource professionals, administrators, chief nursing officers, and other clinicians to address healthcare workforce needs. She also serves as a liaison with the Pennsylvania Coalition of Nurse Practitioners, the Pennsylvania Society of Physician Assistants, and other healthcare practitioner groups, as well as the State Board of Nursing, the State Board of Medicine, and the State Board of Osteopathic Medicine. Mary leads and manages the Healthsystem Association of Pennsylvania's Donate Life Hospital Challenge, which encourages Pennsylvania hospitals to increase organ donation awareness and designations within their hospital and community. Our second speaker is Kathy Yandle, the Manager of Hospital Services at Gift of Life Donor Program, where she has worked for nearly 20 years. She has extensive experience with program development for the adult learner, medical professional, in respiratory care, and a wide range of areas in the organ and tissue donation process. She coaches, mentors, and manages hospital services staff who assist with hospital personnel, with hospital education, policy development, and state and federal regulation. Kathy received her education in respiratory therapy at Northwestern University Medical School in Chicago and holds a master's degree from St. Joseph University in Philadelphia in Organizational Development and Training. Our final speaker is Christie Ryan, who is the Director of Professional Services and Regulatory Affairs for CORE, the Center for Organ Recovery and Education. Prior to joining CORE, Christie was the Chief Nursing Officer for Health South Fowicki. She was previously employed by Kindred Hospital of Pittsburgh as a nursing supervisor of the critical care unit and with McGee Women's Hospital as a critical care nurse. Christie has presented on a national level regarding topics related to best practices to achieve 6 Joint Commission accreditations and certifications in traumatic brain injury, stroke, spinal cord injury, and multiple sclerosis. Christie has also been recognized for her efforts to lead the team to achieve the first Joint Commission certification in multiple sclerosis in the United States. Christie attended Waynesburg University, where she obtained her Master's of Science in Nursing and Administration.
Great,
Mary,
thank you,
I can turn it
Amanda.
over to you now.
Barry, are you still on the line?
Yes, I am on the line, and thank you, Amanda and Corey. I appreciate it. Good afternoon, everyone. We are honored to share our story with you today. My name is Mary Marshall, and I serve as the lead for Pennsylvania's Donate Life Hospital Challenge. The Hospital and Health System Association of Pennsylvania, which we refer to as HAP, is a statewide association that advocates for nearly 240 Pennsylvania hospitals and healthcare organizations across the Commonwealth. Our mission is to be the leading advocate for improving the health and well-being of every Pennsylvania citizen. In Pennsylvania, more than 8,000 patients are waiting to receive a life-saving transplant. To respond to the ever-increasing need for organ and tissue donors in the Commonwealth, HAP partners with the Pennsylvania Department of Health and the state's 2 organ procurement organizations to raise awareness about the importance of organ and tissue donation. Our OPOs, the Center for Organ Recovery and Education, and the Gift of Life Donor Program, also support HAP's signature events, including our statewide leadership summit and our Southeast Regional Hospital Recognition event. The relationship that we have established with the Department of Health and our OPOs is crucial to the success of our hospital challenge. Our Donate Life Hospital Challenge began in 2013. It encourages our hospitals to increase organ donation awareness and designations within their hospitals and communities. The goal of the challenge is to increase donor designations. However, it has become quite the competition for our hospital members. The hospital's awareness and designation activities are captured on a scorecard, and participating hospitals can reach certain designation levels based on the scores they have earned. Our hospital members become so engaged in the challenge because they want the bragging rights for earning top designation scores. I will briefly go over how our hospital challenge works. However, my partners, Kathy and Christie, will provide you with more detail later during their presentations. HAP promotes the hospital challenge by communicating with our members through bulletins to our chief executive officers and other clinical leaders. We require our hospitals to register for the challenge. Each hospital must register individually. If the hospital wants their health system to be acknowledged, then they provide the name of their health system during their registration. The participating hospitals must provide primary and secondary contacts for their hospital teams, as those contacts are the communication line between HAP and each participating hospital. All correspondence regarding the challenge is sent to the primary and secondary contacts, who then are responsible to share the information with their hospital team. HAP conducts an in-person kickoff event where we have donor families and donor recipients share their stories. We also have a representative from the Department of Health and HRSA present to the participants. Additionally, we review the details of how the challenge will work. We also support our members by providing monthly coaching calls where we share best practices on donor awareness activities and events. All of our resources, including the scorecard and some promising practices shared by our participating hospitals, are available on HAP's Donate Life Hospital Challenge website. A strong partnership with our organ procurement organizations and our hospital members is the foundation for a successful hospital challenge. Because HAP serves a very diverse hospital population, hospitals need to trust that the rules governing the hospital challenge are fair across the board. Credibility is key, and establishing the rules, and more importantly, maintaining the effectiveness of those rules is paramount. That is why we developed a scorecard and a user's guide. We also found it necessary to develop a question and answer document. Our hospitals have become very innovative with their awareness activities. Determining how those activities are scored and communicating that to the participating hospitals helps to keep things fair. It is important that all partners take ownership of the hospital campaign and that there is accountability. This slide demonstrates the tiers of accountability for our hospital challenge. HAP leads the challenge, and the accountability of the challenge is governed by a planning committee. HAP and the planning committee work together to outline the parameters of the hospital challenge. The OPO hospital services and community relations representatives then have a defined roadmap to support our hospital partners in their awareness and advocacy activities. We have seen continued growth in hospital participation of our Donate Life Challenge. Historically, our challenge ran from April 1st to August 31st of each year. However, we are transitioning our challenge this year in order to align with HRSA's timeline for their awareness campaign. Therefore, our 2018 challenge is for only 1 month, April, Donate Life Month. I have to admit that I was concerned about the transition this year, as I thought the short time frame would prevent some hospital members from participating this year. However, as you can see, our hospitals are still very engaged, as we have 105 hospitals registered for this year. Our hospital challenge has been so successful that the Pennsylvania Association of Community Health Centers and Pennsylvania collegiate organizations have adapted our campaign for their own organ donation awareness campaigns. I would now like to turn the presentation over to my colleague, Kathy Yandle, who will provide you with some historical background as well as some detail about our Donate Life Hospital Challenge. Thank you.
Thanks, Mary. I just want to start by saying what a pleasure it is to work with you and with CORE to really expand and grow this program. I'll tell you a little bit about the evolution of this program. It started, let's see here. First, I'll tell you about the Gift of Life. Gift of Life is the organ procurement organization in eastern Pennsylvania. You can see it there in blue on the map. We also cover southern New Jersey and the entire state of Delaware, but obviously we're talking about this programming that occurs within the state of Pennsylvania. You can see our mission, which is to work in partnership with the region's hospitals and healthcare professionals to ensure that the family of each potential donor is offered the option of donation in a sensitive and caring manner. Of course, that's totally compatible with the mission of HAP as well as CORE, which you'll hear from in a little bit. You can see in our region we have over 11 million residents, 130 acute care hospitals, 15 transplant centers, and 40 individual transplant programs. Our sister organization, CORE, is out in western Pennsylvania, and they have 5.2 million residents, 150 hospitals, and 6 transplant centers. And again, I'm going to let Christie tell you more about CORE a little bit later. My goal, however, is to share with you the evolution of this program. So we started back in 2013, as Mary said, and back then we essentially started it as a workplace partnership for life campaign with HRSA. We partnered with HAP, and we ran the scorecard, which was fairly rudimentary back then, if any of you were involved. And you can see the point level, 100 points for bronze, 250 for silver, and 500 for gold. And we worked on those activities that were embedded within the scorecard. In 2014, we started to customize the scorecard a little bit ourselves. And although it was compatible with HRSA's scorecard, we just sort of made some of the activities a little bit more pronounced and precise. We also noted that on the Workplace Partnership for Life scorecard, most of the events were centered around hospital communications and events, and also community engagement and events. And so these activities were primarily in raising awareness about organ and tissue donation and about inspiring individuals to put donor designation on their driver's license. And that was great. We had a great 2 years, pretty much mirroring the Workplace Partnership for Life scorecard. And we partnered with HAP, and we had an awful lot of involvement, as you can see from these community photographs on this slide. As the program grew, we were really happy with it, and we started to think, well, how can we expand upon it? So we were thrilled to be able to increase the number of donor designations, but we were thinking, the practice in our hospitals, there's still variability in the way the clinical activities unfold. So we decided, why not use this scorecard to promote the optimal donation practices across the region's hospitals, and ultimately, through all of these things, we can improve rates of donation and transplantation. Again, we took a long, hard look at the scorecard, and we did keep all of HRSA's components. So the Workplace Partnership for Life scorecard is completely compatible with our HAP Donate Life Hospital Challenge scorecard. And you can see here that the community engagement events, holding donor registry enrollment events, having large-scale media events, they're all compatible with the Workplace Partnership for Life. However, as we expanded on this scorecard, you can see that we added hospital OPO collaboration for hospital education and donation process improvement initiatives. So to the HAP scorecard, we added things such as ICU, OR, or ER nursing in-servicing, ICU support staff in-servicing, hospital staff attending programming, either put out by the OPO or by HAP, grand rounds, resident education, hospital oversight group, clinical oversight groups, physician department and staff meetings. We added nursing department and staff meetings, multidisciplinary donor councils, meetings to provide education for the CMO, Director of Critical Care Medicine, and other physician leaders, hospital administration, and yes, the hospitals get points for after action reviews, and even rounding, going unit to unit, talking about case follow-up or just donation process variables. So the nature of some of the activities changed somewhat. And in these pictures in the upper left-hand corner, that is Dr. Barace, who is employed at Regional Hospital Scranton, giving a talk on the organ donation process. In the upper right-hand corner, you can see an administrative meeting where the CEO is conducting a meeting with his leadership team, and we're there on site to help provide them with information, with data, and updates on how the process is going. Down in the bottom left, that's a donation champion training, whereby we have a panel of donor family members, recipients, and other experts who are talking to an audience, usually of about 100 people, about the donation process. And in the lower right-hand corner is our CEO, Howard Nathan, who indeed is also giving an educational presentation in one of our local hospitals. So with that said, we now have combined the HRSA Workplace Partnership for Life with the HAP Donate Life Hospital Challenge. The scorecard's rather elaborate, but it is a work of genius in that when the user puts in the number of activities in that column, the points automatically total, plus if it's something that gets transferred to the HRSA scorecard, it also auto-populates the HRSA scorecard. So I want to bring to your attention on the bottom left, you can see this is the tab for the HAP scorecard, because not everything that is in the HAP scorecard is in the HRSA scorecard. But when you click on the HRSA scorecard, the HRSA scorecard itself will come up, and it will be auto-populated with items from the HAP scorecard. And this, of course, is the current HRSA Workplace Partnership for Life scorecard with the point values. And I do believe this isn't the current one because I believe that HRSA has also added a point value for platinum. We did that a few years back as a stretch goal, if you will. But in 2017, we went from bronze to silver to gold to platinum, and we are now introducing, in 2017, we introduced a titanium award, which is really an expanded goal because so many hospitals were able to win the platinum award category, and they're just improving and moving forward and getting better, and the competition is getting stronger. And so we were worried that maybe hospitals wouldn't meet that titanium award, but as you'll see later in the presentation, we were pleasantly surprised to see that they had. So in 2017, we really did complete the process of including process and performance improvement activities within our scorecard and within our challenge. We focused on hospital staff education, critical care, ER, OR, support staff, but we also included community awareness and inspiration to be a donor and to become donor designated. And through all of this, and really the leadership at HAP and the collaborative working relationship between the OPOs and HAP, we have been able to increase donation and transplantation, and we have seen a rise in donor designations. So again, this is a really beautiful process in that HAP takes the lead. They coordinate the planning meetings so that everybody's on board. They're the ones who send out the registration to the hospitals and then host a kickoff meeting. And then Mary organizes the coaching calls, which really, it's a way to share promising practices. HAP maintains a web page presence, and as you can see, all of our materials, the scorecard, the promising practices are all housed on that website. And then HAP, of course, recognizes hospitals for their efforts. The OPOs, we provide strategic recommendations to HAP, and we have all worked together to develop this scorecard. Each OPO develops their own creative materials featuring individuals who are really from that region to bring the donation process close to home. Our hospital services coordinators and professional educators guide the hospital's steering committees, but the hospitals do put their own steering committees together, and it's a real competition. I mean, they strategize about how they're going to get the most points, and honestly, they strive to save the most lives as they possibly can. The OPOs provide speakers for the hospitals, and we recognize hospitals as well. In Gift of Life region, we go into the hospitals with a celebration, honoring the hospitals with awards, perhaps at board meetings and high-level meetings, but also with the frontline individuals who really are the boots on the ground for this process. At CORE brings all of the hospitals to them for a giant celebration, for award ceremony, and to thank them for their efforts. I'm going to stop right there on the evolution, and I will ask Christie to chime in and tell us about our outcomes.
Thank you so much, Kathy. I appreciate the introduction, and I am so thankful and grateful to be a part of this collaboration and this presentation today to talk about what we do together, both the OPOs and for HAP. So I'm Christie Ryan. I'm the Director of Professional Services at CORE, And our mission at CORE, we're a nonprofit organization dedicated to promoting donation, education, and research for the purposes of saving and improving the quality of life through organ, tissue, and corneal transplantation. Our vision, as you can see, is every potential donor will make a pledge for life. So driving hospital engagement, I see this as, I would say, fishing. So hook, line, and sinker. For us, the hook was the competition. There's a lot of competition, and this just helps to promote what our mission is, donation. The line is the assistance that both us and HAP provide, and the sinker is the recognition. So for the competition, this honestly is a chance for smaller hospitals to shine. All points aside, it comes down to creativity and what they can do to promote a culture of donation. We look at it from system versus system. So in Pittsburgh, we have two very large systems. We have Allegheny Health Network and we have UPMC. More times than not, they're very curious as to see what other hospitals are doing to promote donation and to really ensure that the culture of donation is in each one of their hospitals. A way to do that is to put a point system to it, which HAP has so graciously helped us with. And hospital versus hospital. You can see this within the system, within the same system, and sometimes it could be other hospitals. So if a nurse came from, let's say from CORE's DSA, they came from West Penn Hospital, which is in the Allegheny Health Network, versus a Presley Hospital, which is in the UPMC. They used to work there. They want to know, what are they doing? What do their points look like? So that really is that competitive nature. We kind of grab it up and we utilize it to continue on our mission. So the line is the assistance from the OPO, whether it be CORE or Gift of Life Philly. So we, again, as Kathy had mentioned, there's marketing materials that tends to be branded towards that region and the population to which we serve. We create things like e-learning modules, and we use this during our Donate Life Month. So any education that's out there, if a hospital so chooses, they could provide that to the hospital, and nurses, physicians, ancillary staff, it's available to them. As always, we provide on-site education. So members of my team here at CORE, the professional services team, they go on and they speak with everyone, anyone in the hospital. They speak within the community to promote donation. And how that works with the collaboration for HAP is that there's points that are associated with that. So it's a win-win situation for each the OPO and for HAP. We provide volunteers and speakers, so we have table events where the volunteer will sit and try to promote not just our donation but also the hospitals. More times than not, our CORE volunteers really enjoy going back to the hospitals that have served them, as well as the speakers. And again, we do provide support for the scorecard. As Kathy said, there's a lot there. It can be complicated, and understanding the best way to manage, really we do it all the time, and we enjoy that one-on-one and hearing about what the hospital is doing to promote donation and to participate in the HAP Challenge. So marketing materials. So for HAP Donate Life Hospital Campaign, really the sky is the limit. HAP has always been generous in the sense that it will give you a direction, but you also have the opportunity to do any kind of plug-and-play materials that you're interested in. One such thing is what CORE has done, and this is what a hero looks like, really promoting heroes and the fact that donor families are giving that gift, that they are a hero to the recipients. We do things like newsletters, and we always promote that, the HAP Association is promoting Donate Life Month, and here's the HAP Challenge, so that always goes out in the newsletter. We provide talking points to hospitals, so when they decide they want to go and put things on Facebook or Instagram or even Snapchat, whatever their social media is, we provide them with the accurate information. And again, that lends itself to additional points. T-shirts, PowerPoint presentations, there's a lot of ways that we can promote via marketing materials. So the thinker is the recognition, and Kathy did touch on this. The exposure that you get within the community, that HAP has really helped everyone to understand the importance of making this really our month to promote donation, and got all of the hospitals together. I know for CORE we have a huge amount of participation, as does Kathy and Gift of Life Philly. So the exposure in the community comes from not just all of the flag raisings that we do, which there are many, many, and the table events, and the social media. There's a lot of opportunity to get the conversation going thanks to our collaboration with the Hospital Association of Pennsylvania. Then for the hospitals, the exposure that they have is within HAP. So there are calls that we're on. There is, at the end of all of this, there is always usually a nice celebration and the ability to see what others are doing. So to get your hospital out there for the community, and then within other hospitals for possible future collaboration, has really been quite the inspiration and serves to help everyone that's been involved. Here I just put up a few pictures of different CORE events, many of which are there's speakers, there's recipients and donor families. Of course, I had to, right in the middle, put a picture of my fearless leader, my CEO, Susan Stewart. But many of the people that are shown here are people that just come out to celebrate and to promote donation, all during the HAP Challenge. So here is Katie Demko. She is a CORE employee, but here you can see a picture of her. So during Donate Life Month last year and for the HAP Challenge, UPMC Healthsystem had a system-wide initiative. It was named Stop the Wait. So basically it was held in Pittsburgh at Market Square, and hospital employees, CORE representatives, donor families, recipients, and those waiting filled Market Square, and for 22 minutes they stood in unity, in silence, and for that basically it signified the 22 people who die each day on the waiting list. There were matching t-shirts and hand tattoos, and again, this all came about just because of the HAP Challenge. You got a lot of creative people in the room, and they decided we want to do something not just within our hospital and not our hospital system, but really for the entire community. So for this one, this was in Philly, I believe. It's Temple University Hospital. So this is a flash mob, and how exciting would that have been to see? The locations were never known, so you can see it's a nice large group of people that are matching t-shirts. And what they're doing there, they're gathering together to commemorate National Donate Life Month for the Hospital Challenge, and they all sang the Circle of Life. So that must have been a ton of fun, and really to push that message of passion and for advocacy, just amazing. So here we have Donate Life Month at St. Luke's University Health Network. This is an indoor football team. This event was sponsored to raise awareness of our shared mission of donation. In the picture with the big blue heart, that's Heartman. And basically Heartman and I guess his name is the Steel Hawk, they went around and really just promoted what we all promote. It's donation, and it's wonderful. Again, this happened during the HAP Challenge. You get those creative minds together, and we are unstoppable. Here's one of my favorite pictures. So the picture on the left is the Erie Bicentennial Tower lighting. And for that, the tower in the water is lit in the month of April to celebrate National Donate Life Month. The tower in the hospital there's a tower on the hospital which is also lit for 24 hours following a transplant to celebrate the gift of life. And this is done every April. It used to be done a little bit longer for National Donate Life Month, but they do this because of the hospital challenge. So the one on the right, which is Penn State Hershey Medical Center, also known as the Crescent in Hershey, PA, basically the same thing. The entire medical center is lit up in green for the purpose of promoting donation through the month of April for the hospital challenge. So as Kathy had mentioned, the Titanium Award for the HAP campaign in 2017, we were so proud at CORE to be able to name 5 separate hospitals that were able to reach this really designated, distinct achievement. It was Allegheny General Hospital, Children's Hospital of Pittsburgh of UPMC, Conemaugh Memorial Medical Hospital, UPMC Hammett, and UPMC Presbyterian. We were very proud. And for the HAP campaign for 2017, Titanium Achievement, Gift of Life Philly also had 5. Geisinger Medical Center, Hospital of the University of Pennsylvania, Reading Hospital, St. Luke's Hospital, Bethlehem, and Temple University Hospital. So again, this was a brand new level of achievement that hospitals could work their way towards. And of course, anytime you add a new level of achievement, there is a sense of what more can we do to be able to promote donation with the help of HAP. And people, they never cease to amaze. If you give them a goal, they reach for it. And we benefited greatly. The lives that were saved during that month due to promotion, it's endless. So for our clinical results, so increase in conversion rates in donors. So Gift of Life had 12 hospitals increase conversion rates, and 10 hospitals increase the number of donors. That is fantastic, and each person that participated really should give themselves a round of applause. That's fantastic. For CORE, we had 10 hospitals that increased their conversion rates, and 14 hospitals increased in the number of donors. So that's comparing 5 months pre-challenge versus the 5 months during the challenge. So really, as you can see, the HAP Challenge has really helped us not only create that culture of donation, but really inspired all of the hospital employees and engaged them in what we think is one of the most important missions, saving lives. So I thank you all so much for listening, and I will give it back over to our moderator.
Thank you very much, ladies, for such an insightful presentation. Before I turn it back to Amanda for questions, just as a reminder for everyone, if you do have questions for any of our presenters, please submit them using the chat feature in the bottom left-hand corner of the screen. While we're waiting on questions to roll in, I'd also like to take this opportunity to remind you about the Alliance Organ Donation Toolbox. It's an invaluable free library of more than 550 peer-shared documents with a variety of best practice resources for the donation community of practice. So you can access the Toolbox by going to organdonationalliance.org/resources. You'll also find directions for saving the Toolbox as a bookmark to your smartphone home screen for convenient access. Now, during the Q&A time, I will have this poll up. For those of you listening in a group, if you could please complete this poll for us and let us know how many people were listening in your group, that would be very helpful for us. So at this point, I will turn it back to Amanda to moderate our questions.
Hi, Mary, Kathy, and Christy. Thank you so much for the presentation. We do have a few questions. Our first question is, can you give us more details regarding how the coaching calls work?
Oh, sure. This is Mary Marshall at HAP. So our coaching calls are designed to share information and best practices and to provide the hospital teams the opportunity to network with each other. So we've learned that the best way to manage the coaching call is to identify specific topic areas and to conduct the calls during the same time each month. For instance, every third Thursday of the month was a coaching call from like 10 to 11. So the planning committee established the topics for the coaching calls. For example, last year our topics were how to develop a flag-raising event, increasing clinical education and engagement, community engagement and inspirational activities, and utilization of social media. And we always share our last coaching call. We save our last coaching call to review the completion of the scorecard. And each OPO identifies one hospital in their service area that has demonstrated success in the activities they've engaged in, And the coaching calls provide those hospitals with the opportunity to showcase their best practices. For instance, the Flash Mob Temple University Hospital, they shared during the community engagement and inspirational activities. And it was really quite exciting to learn about how they did the flash mob and the outcomes of that flash mob. Some exciting things have been happening, and as I mentioned, our hospitals are very innovative, and they're very honored to share their best practices with their colleagues. Kathy or Christy, do you have anything you'd like to add?
I don't, Mary. We're so appreciative for your organization skills, prompting us, and like you said, we bring those successful teams in to share their stories, which is really an extra bonus and feather in their hat to be able to share those stories. But it's your organization that holds us together, I have to be honest.
Oh, well, thank you. That is one thing. I have to be honest, this is one of my favorite projects to lead because we're really making a difference in people's lives, but strong organizational skills are a must. So thank you, Kathy.
Thank you. We have another question. Regarding the hospital steering committees, are these separate working groups or a subcommittee of the hospital's donation committees?
Christy, do you want to take that one?
I sure can. Hi, this is Christie Ryan again. So it really depends on the hospital. Many times the steering committee is it really is a focus on what you're going to do for National Donate Life Month. Oftentimes there are leaders on the calls or meeting to ensure that they're doing everything that they can and that they have the right parties at the table, which is a little bit different than like a donor advisory group. So oftentimes you have your ACR, which is the person, your liaison for the hospital, who leads that along with a member of CORE to help them to better understand what's going to make the most sense during that month. Do you have anything else to add, maybe Kathy?
This is Kathy. I'll chime in that. I agree with Christy. It differs among hospitals. I think the most common format that we see is a subcommittee of the donation advisory group or the donation council, because these are individuals who can really focus on the project, can manage the scorecard, but they also engage their public relations, community relations people to make sure that the project is well-rounded, not only hospital education, but also community education. It's a big project for every hospital. And I have to say this, we also obtain hospital leadership. So this is sanctioned, supported, attended, and by the hospital administration. The CEOs hear about this every year. As we have our hospital CEO, we join our hospital CEO for a meeting with our OPO CEO for a meeting with the hospital CEO. We do talk about the Donate Life Hospital Challenge, so we get support from the very top.
That's true, Kathy, and here at HAP, we also have support from our senior management staff, including our Chief Executive Officer, who does sometimes presentations and includes information about the challenge during those presentations. We also are supported by leadership because we do some communication out to not only members but to the community as well. So we have a consumer-based communication platform. It's called Healthy Me PA, and for this year particular, we're doing a special communication around organ donation during Donate Life Month. So we have a lot of support from our association leadership for this endeavor, and they're very excited about it as well, because a lot of the CEOs contact our CEO because they want to know what's the status of the challenge, and they really kind of can't wait to learn the outcomes. So it's an exciting project.
Thank you. We still have time for another question.
Well, this is Mary Marshall at HAPN. While we're waiting for a question, I just want to say that it really is a remarkable project, and the collaboration between the Hospital Association and the organ procurement organizations is just phenomenal. Like I said, it's one of my favorite projects to lead because I know that everything that we're doing is making a big difference in people's lives. And so we're a strong partnership. We've become a strong partnership. I've learned a lot through this project with regard to organ donation. But I have to say, whenever I do have a question or something, I can always reach out to my friends at our organ procurement organizations to help to get that information for me. So it's really a very good, strong, collaborative project.
We do have one more question. We have many hospitals participating in the HRSA campaign, but they would like to know how you've incorporated a process and performance improvement focus along with education. Would you be willing to share your scorecard?
Hi, this is Mary Marshall at HAP again. Actually, our scorecard is posted on our website. It actually is a public website. So in the presentation, I provided the URL. And you are more than welcome. You know, our attitude is sharing is caring, and so you are more than welcome to click on that link and access the information that we have on our website, including the scorecard. I do have to tell you, the scorecard itself is really an awesome piece, really put together by the organ procurement organizations to match up with HRSA. But they were able to augment it with our additional levels. And so the fact that our hospitals are able to incorporate the score for whatever activity, and then it actually populates into the HRSA scorecard too, is really a good source. So you are very welcome to access that on our website.
Thank you.
Amanda,
we have another
Kathy. Oh, Amanda, may I sort of augment that a little bit? I was sitting here thinking about the scorecard and about how do we get the clinical component. You know, we love the Workplace Partnership for Life scorecard, and we submit that, you know, each and every year on behalf of our hospitals. The thing about the HAP scorecard is we require documentation. So if there was, like the physician where Dr. Barres was giving a lecture, we now, in order for that hospital to obtain those points, the hospital has to submit to us an agenda, maybe an announcement, maybe their PowerPoint presentation, but something substantial. And they actually put together either an electronic or a physical binder where there is a tab for the ICU, ER, and OR in-services. And behind that tab, there's documentation of every educational event that occurred to substantiate the points. So this is, we're running a really tight ship, and over the years as this has evolved and the competition increased, some of the hospitals, you know, really wanted clarification. Where do I put my screensavers on our outbuildings that are associated with the hospital? What? You know, so they came up with these creative ideas that we really needed to create categories for them. We needed to expand on the questions and answers. And as this scorecard continues to evolve every year, we still maintain that they only get the points if they document supporting documentation, if they submit supporting documentation to substantiate that they've earned those points. So it really is an amazing competition. This year we added a couple things. We in one of the line items, it was have educational meetings with physician leaders. Well, someone said, what if I meet with a physician who's not necessarily a leader, but a physician? We actually had to change the scorecard, update it a little bit to include that. So it really is a dynamic process to keep this thing going, but it does focus on the right people who can make influential improvement within the clinical setting, as well as increasing donor designations for the community inspirational activities. Thanks. I just wanted to add that.
Thanks, Kathy. And really, when like I said, our hospitals do become very innovative, and so a lot of times they contact me with these questions, and I reach out to the planning committee, and we have a discussion on how best to score that activity. And we're always mindful about keeping things fair across the board, because we do have small rural hospitals and large hospitals and health systems involved in the challenge, and we want to keep it fair across the board. So it's very good. We have a strong planning committee that includes not only HAP representatives, but representatives from the organ procurement organizations. So that's a good process to keep in place, and that's why we developed the user's guide that we continue to update, as well as the question and answer document that we continue to update, because then we have all the information dedicated in writing so that everyone understands how the process works.
Thank you. We have one final question. What department at HAP handles this initiative, and what information can you give on the number of staff and other resources that are dedicated to this program?
Okay, this is Mary Marshall, and I will be totally honest with you. My title is Director of Workforce and Professional Development. I am within our policy department here at HAP, and I am the staff that supports the hospital challenge. So I lead it, I manage it, I get administrative support from my administrative assistant. And the thing is, the point I want to get across is it doesn't have to be confined to one particular department or a certain number of staff. As I mentioned before, organization is very strong, and I know that the reason I was chosen to lead this challenge is because I have strong project management skills. So think outside the box. It doesn't necessarily always need to be a clinical person, but yet if you have someone in your association that has strong project management skills and is very organized, they can lead your challenge as well. And I would be happy to shepherd, if you wanted to contact me directly, because what I've done is I've put a system into place here so that I can continue to be organized and lead the challenge successfully each year. But I would be happy to talk with anyone and shepherd anyone through the process at their hospital association.
Thank you.
All right, if there are no more questions, we can go ahead and conclude today's presentation. We would like to extend our sincere thanks once again to Mary Marshall, Christie Ryan, Kathy Yandle, as well as Amanda Habermill for their time and for an outstanding presentation today. To all of our participants, we want to thank you as well for your time, and we wish you a wonderful rest of your week. Thank you very much, and take care.